Hi, everybody. My name is Renan Augusto. I'm a client liaison manager and marketing coordinator with SmithLife Homecare. We're doing our Ask the Expert today with JSSA. This is my first Ask the Expert, and I'm so flattered to have these ladies, Miss Mariana Gresti and Malfina Robinson from JSSA, who's going to tell us a little bit about the operation at JSSA and hospice. Ladies, thank you so much for joining me today. How are you doing?
Brennan, we are doing great, and we are just thrilled and honored that you invited us to participate in the Ask the Expert series. And for Malfina and I, it's just a great opportunity to work together once again. All around great. We're doing great.
Great. And I'm so excited to have you. I really thank you for the opportunity. And let me start off by asking you, can you tell me a little bit about yourselves?
Sure. I started my healthcare career, and I hate to admit this, but well over 20 years ago. And a good portion of my healthcare career has been in hospice care. I am from New Jersey originally, and I spent 14 years of my career, a year with a for-profit, and then 13 years with a non-for-profit. But I relocated here to the DMV to be closer to my family, where I then joined MedStar Health as a business development professional. And then I went to a small Montgomery County SNF, and I am thrilled to join the JSSA team, who are very committed, hardworking, and just a joy to be with. I am working with a group of real professionals who genuinely care about their patients and genuinely care about their families.
Wonderful.
I'm Malfina Robinson. I've been a nurse for over 25 years. I started I was a former employee at the Charles C. Smith at home. I started as a hospice aide and became a registered nurse. I worked there, and that's how it's part of my interest, because I would see the hospice nurses from JSSA come over to help take care of the patients at the Heber home. And with collaborating with them, I later on transitioned over to JSSA Hospice. In 2005, I started as a case manager, and I stayed in that role, managing, taking care of patients all over Montgomery County until I transitioned to a position as a hospice aide supervisor and / the DME coordinator. And I stayed in that position. I had a team of hospice aides, about 13 hospice aides and 2 team assistants to help with the coordination of the medical equipment. And I stayed in that role for about 2.5 years, and I transitioned as a clinical manager for the Blue Team. It's been 2 years now. I am thrilled. I love working for JSSA.
Did you say the Blue Team?
Yes. So so we have 3 teams in hospice. We just decided on, the color. It doesn't mean anything, but it's the blue team, the red team, and the green team. And that is divided based on geographic, so that we don't have our nurses kind of going all over the county, because we want them to be, when providing care, they could be there within a certain time. So we kind of put them in geographic areas. So that's how the teams came about.
Interesting. It's amazing how much experience you ladies bring to the table. And why JSSA? What is JSSA? I have all these questions.
Okay, great. So JSSA was founded 130 years ago for members of the Jewish faith who did not have any other place to go, who were being prejudiced against. And our title is the Jewish Social Service Agency. But having said that, we service probably over 60% of our patients are non-Jewish. And well over 60% of our staff is as well. So we are open to help anyone of any interdisciplinary faith, any religion, and we are kept up to date with any mores of various cultures and religions, and how to work most effectively with them, and how to understand their way of taking care of the very ill. And we respect everyone, no matter what religion they are.
So JSSA Hospice, we're 24 hours, 7 days a week. We provide care, around the clock. And again, we go everywhere in Montgomery County. We pride ourselves, we usually say, oh, the JSSA way. And what I mean by that is because we've had other clinicians join JSSA. We are very collaborative team. We utilize all of our disciplines to provide exemplary care. And again, so our business hours is 8:30 to 5, and up to 5, we have an on-call service that takes calls for JSSA. And there's a nurse that is available on call to respond to any kind of emergencies, or if whatever the families or patients are in need of. So it's 24 hours, 7 days a week.
So sometimes we're getting calls at 2 a.m. from a family.
Is that the green team or the blue team that gets the calls?
It doesn't matter.
Doesn't matter what call.
So it doesn't matter because the nurse that is on call covers, the entire census. So the triage takes the calls and they try to triage any kind of issues. But if a visit is needed, then that on-call nurse is being alerted to go to wherever the patient is to manage whatever symptoms, whatever the need is. We go.
And we've sent people out during snowstorms.
Of course, having the safety, ensure that the patient and the staff member is safe as well.
We do have to make sure the staff member is safe. We're great. This team is great, the JSSA team, to its staff members, and respects us highly.
No, I've heard, and that's why I really wanted to ask you ladies for the Ask the Expert, because I've heard so much about JSSA, and I just never really understood what JSSA is. And in terms of the clients you service, you provide hospice care, and respite care. Is that correct?
Right. Well, so hospice is a Medicare benefit. So. Okay. A physician has to deem the patient has life expectancy of 6 months to end of life. So the physician would hence make a referral to hospice care. So once a patient, there is an evaluation, the admission process, we have an intake team, admissions nurses that would do all the coordination, and the admissions nurse would meet with the family to explain what hospice services that we provide. So once the patient is enrolled into hospice care, we have core services. We have the hospice, we have different services. We have the medical directors, we have a team of medical directors that help with managing any kind of symptoms, help the clinicians. We have nurses, we have social workers, we have chaplains, we have hospice aides. We also provide medical equipment, incontinence supplies, wound supplies, and there are different types of care. So respite care is part of the services that we provide. If family members just want to have a break in the day-to-day care and managing of the patient, we have contracts with local facilities that we would transfer that patient to that facility and continue the care while the family or the primary caregiver, takes a break. And also there is, what's the other kind of care? It's respite care. There is inpatient kind of care and short-term inpatient, what we call GIP. This is for symptom management
and pain control.
So sometimes we provide as much as pain relief, but if it's too much, we will transfer that patient to an inpatient facility. it has skilled nurses as well that provide round-the-clock care. So once that pain is been managed, then the patient moves back to their home setting or wherever their home is.
Interesting. And do you provide these services in Montgomery County or Washington, D.C., both?
No, we like that question because we are a Montgomery County hospice service. Having said that, we are looking in the future into getting into Northern Virginia, Prince George's County, and expanding. You know, we've had the tough job of, as everyone in healthcare, of COVID, which has delayed some of our expansion, but we see it, it's in the stars. We can see that that will happen in the future. Don't have a time, but it will happen in the future.
Well, it's very interesting, and it's just so much information. And I think that we could easily do this for an hour, but I know we only have so much time. So what we're going to do is we're going to put your information here at the end of the video for anybody who's interested. Is there anything you ladies would like to also mention?
Well, you know, hospice is not a contract. So, you know, you're not legally bound to stay with hospice. We want you to know that we're here to help out the patient and the family. So we also have a program for individuals before they go on hospice care.
It's the transitions program, and it's a volunteer-based program. So patients that are quite not eligible for hospice will enroll them. It's no payment to them. It's strictly volunteer, but again, it helps us keep an eye on the patients as their disease process progresses, and if they're declining, then we will do an evaluation and admit them to hospice. So hospice care, how long can a patient stay on hospice? Hospice is
6 months
or
greater.
Yes. So the way it works, what Medicare did, it divided hospice into benefit periods. So the first 2 benefit periods are 90 days, and the core services, the team, including the medical director, would reevaluate the patient's disease process, because you have to be declining. There has to be a progression of your disease. Again, your physician had deemed that you have a life expectancy of 6 months to end of life. So at the end of that 90 days, the team would determine that you're still eligible and you would enroll into another 90 days. And after that 90 days, then there is unlimited 60 days. But at the end of every benefit period, there has to be an reevaluation to determine eligibility.
Great. It's a lot of information, a lot of useful information. So if somebody's interested in signing up for services with JSSA, how would they go about doing that?
Often it happens either when a patient is being discharged from the hospital.
Okay.
Or it will happen at home, or it will happen in a nursing home. Often the case manager or the director of nursing or even a family member will call us. And then we will go forward with the whole hospice program, speaking to that individual, seeing how he or she is doing, taking a look at the report. And then should they choose hospice care, we will have an admission nurse go right. We'll have an admission nurse take a look at the individual and see if they qualify for hospice care. Then our nurses will start the program with our aides and the interdisciplinary team.
So it's not only from hospitals and nursing homes and families, we'll also get referrals from private physicians as well that we've had longstanding relationships with. And so they would refer the patient because they've been managing their care and obviously determine that the patient, it's time to seek specialized care, hospice care. So.
And the physicians, as Melvina said, are very instrumental, of course, in this role, as well as our medical directors.
Interesting. I want to thank you ladies so much. It's a lot of information, like I said before, and we're going to be putting up the information for JSSA. I want to thank Ms. Mariana Agresti and Ms. Malfina Robinson for joining me for my first episode of Ask the Expert. I'm so flattered to have JSSA as my first Ask the Expert. To all the viewers, my name again is Renan with SmithLife Homecare, and thank you so much for watching. Take care, ladies.
Thank you. Our
Brenda, for
pleasure.
having us.
Bye-bye.
Bye-bye.